Have you ever experienced your loved one suffering from a terminal illness and feeling helpless and wondering if there was more that could be done for them? Well, in some states in the United States, there is options. Dr. Jack Kevorkian was a very famous central figure in the national drama in the 1990s, surrounded by physician-assisted suicide. He helped many of his patients with a suicide by prescribing medications of a lethal dose that ended their lives. But in 1999, he was convicted of second-degree murder in Michigan for recording himself giving a lethal dose to his patient. According to the Harvard Review article, the right to die with assistance is the authorization, a patient giving authorization to a physician to perform the act that intentionally results in the end of life without being civically or criminally liable. People request physician-assisted suicide for the same reason that they refuse life-saving treatments, because they want to be able to control when they die, where they die, and what physical and mental status and state they are at the time of their death. According to the article in Modern Health, between 1994 and 2013, hospice and palliative care spiked from 2,460,000 to 1.5 million. Many barriers were due to insufficient funds from Medicare reimbursement, which hindered referrals from physicians. A Gallup survey in 2015 showed that 69% of Americans still favored allowing doctors to end patients' lives by some means of painless means. In 1994, Oregon was the first state to pass a law allowing physicians to prescribe medicine, allowing patients with terminal illnesses to end their life. That law is called the Death with Dignity Act. There are many rules that go into consideration with this. One of those is a patient has to give their physician an oral request. That their attending physician has to determine whether the patient is competent enough, in the right state of mind, and has a mental status and capable of making choice decisions for themselves. They also have to have the capacity of administering their medications. They also need to be counseled to ensure that they are able to make informed decisions, know the risks and the results of taking these medications, and alternate options. It's recommended that they also inform their next of kin. They also need to make referrals if there's any concerns of their mental health. Another requirement is they have to make a written request to their physician that has to be witnessed by someone other than a loved one, their attending physician, anyone in that clinic where the attending physician works, or that person that owns the physician. The attending physician also has to make a referral to a consulting physician to confirm that the diagnosis of the terminally ill patient has 6 months or less of life expectancy, and that all of the other requirements are agreeable. After all these are checked off the list, the patient is prescribed a medication, and then the patient gets to decide when they are wanting to take the medication and end their life in a humane and dignified way. So there are options available for a person that is wanting to end their life in dignity, as long as their life expectancy is within 6 months and they have a terminal illness.